I'd first of all like to introduce myself. I'm Lisa Brophy. I'm Professor of Social Work and Social Policy, and I'm also the domain lead of the Care Experience domain in the Care Economy Research Institute. And I want to welcome you all here for this webinar this afternoon. Just in terms of a little bit of housekeeping, we'll be hearing from our 4 students. But before that, I want to begin by paying my respects to the traditional custodians of the lands on which we're meeting today. I'm on the lands of the Boon Wurrung people. We recognise that Indigenous Australians have an ongoing connection to the land, and we at La Trobe value their unique contribution both to the university and the wider Australian society. So thank you again. I want to just say that what we'll do is we'll hear from each of the students who I'll introduce just prior to them speaking. I'm hoping that everybody will be able to put their questions in the chat, so I'll be monitoring the chat and we can have a look to see what questions people have, and we'll have some time for discussion, and we'll be finishing up at 3:30. But to begin, I think I'm going to hand over to Claire, who's going to tell us more about the opportunity that was given to these students through CERI.
Great, thanks very much, Lisa, and thanks to our speakers today who volunteered maybe or was coerced to maybe to talk about their projects that they received funding from. So just a quick introduction. My name's Claire Overy. I'm the manager for the Care Economy Research Institute. As some of you may know, CERI, or Care Economy Research Institute, is one of the 3 flagship institutes at La Trobe. We were launched in 2023, and the purpose really behind CERI is to try to bring together researchers working across disciplines and with industry partners to sort of try and solve some of the gnarly challenges facing the health and social care sectors. The care economy is a very broad remit, starts from everything from sort of prenatal all the way through to end-of-life care and everything in between. So our research members, we have over 160 research members from across 9 schools. They work across 5 domains. You've heard Lisa talk about care experience. We also have care technology, care workforce, care delivery, and care economics, social and policy. And of those 160 odd members, we have a cohort of about 25 PhDs and professional doctorate students, of which a very selection is here today to talk to you about things. And one of the things that CERI really likes to do is to support our members to both develop their career, their research career, by awarding small grants. So particularly for the student cohort of CERI members, we have small grants that enable things like presentations at conferences, where an abstract has been accepted, publications of their research findings in sort of publications, well-regarded publications, or extensions of their sort of their projects or developing projects with industry partners. So over the years since we started offering the grant, we've awarded 7 grants at the moment, and that is sort of equal. They're almost equally split between those sort of conferences, publications, and small projects. So hopefully we've got a good selection here today for you to hear about. We also have another 7 projects under review at the moment. But more than happy, I'll chuck some slides up at the end, and if anybody has any questions, more than happy to answer that. And I'll stop talking, Lisa.
Thanks, Claire. And I think it's wonderful that CERI does provide this opportunity to so many of our outstanding students. And so we're going to hear from them today. How about we begin with Jenny Boak. Jenny is a member of the La Trobe Rural Health School, and has just passed her PhD with amendments. Congratulations, Jenny. Her work focuses on person-centred health and social care, grounded in evidence-based research with expertise in complexity, multimorbidity, geriatric assessment, and value-based healthcare. So take it away, Jenny.
Thanks, Lisa. Thanks, Claire. So, yes, I'm Jenny Broken. I'm a research fellow for both the Care Economy Research Institute and the JRC under La Trobe Rural Health School. I received some funding to undertake some training around implementation science, and the training was called Embracing Complexity. So it was professional development funding. So why embracing complexity? So I'm going to cover that. I'm going to cover what I learned from the course and what I'm doing with what I learned from the course. So I'm a nurse by background and have been a leader and a quality of care advocate for a majority of my career, I'd say all of my career. I have learnt that planning is key to any project, but never thought about what it was in terms of implementation, rather simply creating change. During my PhD, I discovered the world of implementation science. While searching for references from implementation, which was part of my PhD, I came across the Centre for Implementation, which is a Canadian program. The centre uses evidence-based to train, support, and empower people to apply theory and evidence-informed change methods to improve outcomes. Implementation science is a study method that promotes the uptake of evidence-based practice into routine. It aims to improve outcomes, bridge the gap between research and practice. Implementation practice is using strategies to facilitate implementation. With my healthcare background, I knew the complexity of the system, but it still created an overwhelming feeling of dread. Have I covered everything? There is so much to think about. I stumbled across the Centre for Implementation, as I said, and the organisation was relatively new when I found it, but the systems thinking approach to embracing complexity and manage uncertainty was the draw card. Systems thinking is not new, but tying it to implementation science and practical applications is more of a recent concept. I wanted to expand my project management skills and learn how to create meaningful change rather than poorly planned reactionary change to a complex problem. I wanted to learn different ways of working with others in the system, visualize the problem from multiple perspectives to choose a direction, and to learn different strategies to solve complex problems. These images have come straight from the Embracing Care program. So what the course taught me, among other things, but it taught me to think about stakeholders differently. And this was my biggest takeaway from the course, I think. Thinking about the people who are implementing the change, the people who are impacted by the change. That wasn't foreign, I guess. I'd thought about that in the past, but defining what the stakeholders' roles and mapping how they fit within the project was a key thing I learned. I'd often approach a project and think, right, who needs to know about this? Who's going to be part of the team that's implementing the change? And then who's going to benefit from the change? Sometimes I wouldn't always include the people that were benefiting from the change, which was a fault in past projects that I'd been part of. So thinking about each of those three layers, so who's implementing the change, who's impacted by the change, and who else needs to be involved, help me think about what their roles would be as well. So breaking down all of the roles in that. Some would be governance, some would be doing, some would be contributing to the knowledge of the change. And my PhD was a complex problem. And I think looking back on what I did during my PhD, I probably didn't have a strong enough stakeholder engagement at the governance level. I did have executives involved in communicating the change, communicating what I was doing, but they weren't involved in informing anything I did, which I think should have happened. So in retrospect, I would do that. I would engage better with the governance, the higher level, because they are impacted by change and they're also part of supporting the implementation. So what's next? The course has helped me to think about stakeholders differently and think beyond the immediate project. It also helped me to explore various communication methods to each level and the type of communication that each stakeholder might need. I aim to use what I learned to identify more appropriate project teams, so the people who are actually doing the doing, and identify levels of stakeholders better. Develop communication strategies that enable two-way communication, but is structured to how the stakeholders need to be communicated to. For example, if I've got a project at the moment where I'm working with CEOs, the CEOs don't want to receive emails all the time. They'd rather receive a message that could concise and clear at key points, not every week, or not just sharing random information. They'd rather receive that altogether. Or at times, they just want to receive it in the 4 times a year meetings that we have. So trying to work with them on how that's going to work. Some of the time, they don't want to be communicated to at all. They would rather have a delegate be communicated to than them. So we're working through all of that communication strategy at the moment. I aim to develop and deliver protocols that inform sustainable implementation. I think I've learned over years in healthcare and coming into research now, there's a lot of projects that are developed that address an issue now without forward thinking of what that issue might be in the future, or what the generations coming through, and particularly around aging research, what the generations coming through might want. So I think in primarily aging research is where I'm sitting in that space. We need to engage the younger generations. So yes, while we might be supposed to be focusing on research of over 65s, if we don't focus on the younger generation coming through and how they see aging coming through, we are not going to develop adaptable solutions for the future. We're going to address the here and now that might be the next 5, 10, 15 years. But once we get to that, we're going to have to redo what we've done to develop it for the younger generation coming through. And yeah, they might not know what they want, but if we tell them what we're doing, what the problems are now, they might be better informed in the future to suggest what we should be doing. So thank you. It was a great course. Yeah, and not terribly expensive either. So I was very grateful to CERI for that funding. Thank you. Thank you for listening.
Well done, Jenny. It looks like we got value for money out of that one. Well done. That's terrific.
Okay. Need to stop sharing, Jenny, please.
You can stop sharing. Yep. That's great. I haven't seen any questions yet in the chat, but I'm sure you've got questions brewing. So just remember to pop them in. And if I'm having problems seeing them, then just let me know. But so far, I haven't seen any. But now what I'd really like to do is introduce our next speaker, Van He. And Van is a research fellow affiliated with the La Trobe Rural Health School and the University of Melbourne. His research focuses on health services, health economics, and clinical epidemiology. Van has extensive experience in healthcare data management, statistical analysis, and the application of machine learning methods. So take it away, Van.
Thank you, Lisa. Thank you, everyone. I'm glad to be here. Now I'm going to start my presentation. So first, a very brief self-introduction. I did my PhD in La Trobe Rural Health School. I started my part-time PhD in 2019. Actually, I started with research master first and then convert to PhD in the middle. And I do my PhD as a part-time base. currently, my thesis has submitted just for publication, and I'm awaiting next academic board meeting to announce my PhD. So, I consider as conclusion of my PhD study. So I'm really glad I reached this stage. Currently, as Lisa mentioned, I work as a research fellow in La Trobe and also Melbourne School of Population and Global Health. A bit overview of my thesis. I focus on geographic health inequalities in stroke care. Focus on analyzing stroke incidence, survival rates, rehabilitation outcomes, and payments to examine health disparities across different regions. I have some important findings regarding Chinese system and Australian system. The reason I have two systems study because I started with Chinese study at the beginning, and then COVID happened. Unfortunately, due to the travel ban, such kind of obstacles, so I have to pivot to Australian study. So I have two components. The first component is systematic review. I investigate the stroke incidence across different regions in China. We do find that higher stroke incidence in less developed regions as expected, but we also found that increased 3 to 12 months case fatality has increased over the time, which is an alarming thing, indicating the suboptimal post-stroke care, especially in long-term base. And in regional Australia, we found that increased mortality rate associated with weekend holiday admissions. So someone have stroke over the holiday or weekend is at high risk of dying, which patient can't control what when the stroke can happen. So this gives them quite disadvantage in terms of healthcare. And we also found there's high percentage of population experienced rehabilitation delays after stroke, which is also linked to worse rehabilitation outcome. I further analyzed the payment system in Australia, and I found that they does not incentivize better functional recovery. So, which is also an area for improvement. So overall, my study provides evidence-based solutions for reducing geographic disparities in stroke care across two healthcare systems. I want to emphasize the important part of industry partnership in my PhD study. I partner with Albury Wodonga Health, with both stroke specialists and also rehabilitation specialists. And we link hospital data with National Death Index data, and also the Australian Rehabilitation Outcome Center data. This linkage actually empower me to do more analysis in terms of survival status and also rehabilitation outcomes, as patients can die outside of the hospital and patients can receive rehabilitation outside this hospital. So it's important to link the data to get an overall picture. So I give presentation back to the hospital, which help the hospital to understand what is going on and how could they potentially improve it. So I used the CERI funding for the study regarding rehabilitation success and related costs following stroke. I did this study because regional stroke patients are often underrepresented in research, and there is lack of evidence of there. This study advocates multidisciplinary strategy to minimize delays. Mostly the delays are caused by the poor access to rehabilitation beds, because the rehabilitation department share the beds with geriatric departments. So when there are small geriatric patients, then there's less bed for stroke patients. And we also advocate to link the payment to patient outcome. So currently, the payment system, they reward efficiency, they reward shorter stays, which benefit the health care system in terms of saving money. But some patients do need longer stay to reach their best potential because they need more time to recover. Currently, the payment system does not incentivize patients who need longer stay. Instead, they incentivize patients who recover speedily. So if patients recover quicker, like 1 FAME score per day, indicator like FAME efficiency, if they achieve better than 1 score per day, the hospital got incentivize them payments, but it's not the case for those who need a longer stay. So, which is a very important finding. And thanks to the grants, I am able to publish this in the BMC Health Services research, provide evidence to future improvements for stroke care, especially stroke rehabilitation and payments in regional Australia. So, so how does this help my career pathway? Previously, I focused more on clinical epidemiology. Actually, this health services research gives me more options because I can look at the health policy and health economics. As always, there are 2 things: whether it's clinically effective, whether it's also health economically effective, whether they can bring value in health. And I also adopted patient-centered perspective, trying to look at individual patient outcomes, whether patients can benefit from the current design of healthcare system. This also inspired me for ongoing research direction. Currently, I focus on patient-reported outcome like quality of life, and this can be converted to health utility score, which is an important factor for quality of life, adjusted life years, which is very important for health economic evaluations to say whether we should fund any health innovation or intervention or healthcare reform. So yeah, actually benefit a lot from this study. This was a question from CERI, so I have some thought about this. I think it's important for HDR students to build track records for future job opportunities and a grant application. It is not easy to find a job in Australia. So as a PhD student, I would suggest HDR students take the chance to apply for the funds, to do something that is impactful and is linked to industry, so that this gives you some advantage in future job application. And I also think it's important to build hard skills and soft skills. When referring hard skills, I mean something that is really research based. Your ability to develop a protocol, carry it out, write it up as a paper, data analysis, that's hard skills. And also soft skills. Hard skills give you opportunity to get into soft skills, help you secure the job. So I encourage students to take the grants, to travel, to do presentation. Your expression is very important because you can convince future employers or colleagues to have more trust in you in the future, because they all want someone who can present well. And I also think about how to position myself in academia, like define who you are. So previously I was confused. I do different things. So later I think okay, I'm both a data scientist and also a health services researcher. And this gives me advantage in terms in the future. If I want to do quantitative research, I have strong background in data science, and also health services research is quite a big umbrella to enable me uptake other challenges in the future. And I also suggest the HDR students to promote their achievements. We all have different achievements, whether it's minor or it's big. There is always some merit in what you have done. So I contact CERI to promote my publication, as I put a screenshot here. So it's important that we can do this, and also suggest everyone to participate in different events. I participate in Bendigo Health Data Zone, which is I utilize my data analytic skills. And I also participate in the artificial intelligence in public health competition. I won the third prize in machine learning in predicting diseases. Actually, this helps me secure a job because I got connected with people. And when they need someone to do the data, they come to me. So, so this gives me some chances to get actual income. So I would suggest people do the same in the future. Advice for CERI to support HDR students, I think it's a very great platform. If we could connect the students to different opportunities, especially like engagement with industry partners. Is there any internship or voluntary position? Because experiences are universally required when we apply for a job. They don't care whether you are just graduate. They're always looking for something that you have done before, and they don't want to train you as this university do. They want you to be there and start working for them. And also thinking about, maybe some students are thinking about not doing research in the future. They may want to go to industry. Can we have industry mentor, from organized by CERI, so that students can understand, okay, if I want to go to industry, what thing I could do. So I think this may be a good thing if CERI can do. And I would also suggest CERI to list some small projects, even like a presentation, a data analysis, or write a report, and to let HDR students to take this small project announced by CERI. Maybe they come from industry, or maybe they're from different research groups, so that HDR students can do something to build their track records. So when they graduate, okay, we have done this project, we have these publications, I have lots of experience, can better prepare everyone in terms of future opportunities. So that's all. Thank you, everyone. And this is my contact info. Happy to hear from everyone. Thank you.
Oh, thank you, Fan. That was fantastic, and such interesting findings, and such important findings, as well as some really valuable advice to other HDR students. So I'm sure we'll be getting back to you with some questions later on. So don't forget to pop your questions in the chat, folks, and we'll have plenty of time for discussion later in the session. But before we do that, it's time for me to introduce Cass Hopkins, and I'll just tell you a little bit about her before she speaks. Cass Hopkins is a PhD candidate within the School of Psychology and Public Health and Research Officer at the Centre for Alcohol and Policy Research. She's currently completing a mixed methods thesis, which examines how children are affected by the drinking of parents, caregivers, and other adults. So take it away, Cass. Thank you.
Thank you, Lisa.
Should I have called you Cassandra, or was it right to call you Cass?
Either, it's fine. I know my name is
Okay,
Cassandra on
great.
here. I just think I couldn't be bothered to change it. No, but thank you for the introduction. So today I'm going to talk to you about understanding and reducing harm to children from men's drinking. So the grant that I received from the Student Development Fund supported the work that I was doing outside of my thesis. And this presentation has actually come at a really great time because the work that I did, which is supported by these funds, has finally been published. So the funds supported my work in a number of ways. First, I produced a global review on harms to children from men's drinking. And then using these findings, I worked on developing an international policy brief. And then I also co-wrote a conversation article based on this policy brief. And then I also co-presented these findings at an international conference on alcohol and the addictions. So today I'll walk you through the conference, the initial review, the policy brief and the conversation article, and how these have had an impact on my career. Yeah, so I think I'm the only one that's actually still doing their PhD on this panel, and yeah, I'm planning on submitting by the end of the year, fingers crossed, so I'm very much at the pointy end. So in September last year, I attended the World Congress on Alcohol and Addictions conference, where I presented findings from the initial review on how children are affected by men's drinking, and I'll speak more about that review in a moment. So at this conference, I developed ongoing connections with international colleagues working in the space. I presented as part of a panel that was looking at the intersection between gender and alcohol consumption. So our panel chair, Gail, in the red dress there in the photo, she was from the UK, and during this conference, it was really great to develop the connection with her and learn more about her work. I was also lucky to attend a workshop held by Gail later in the week that was looking at how policy frames intimate partner violence perpetration among those who use drugs and alcohol. So collaboration with Gail has continued since the conference, and I worked alongside her and a number of other colleagues on a policy brief that I'll talk about shortly. So this is the initial review paper that I've referred to, and it was published in December last year. So it's a scoping review that looks at men's drinking and the harms to children. It's part of a broader project of three reviews. The first looks at women, the second looks at children, and the final review looks at how alcohol policy might prevent harms to women and children. So this was a really great experience where I was able to work with colleagues from a number of different countries like Norway, the US, Lithuania, and Sri Lanka. So I've started working with CERI from Norway on two separate but related projects that focus on children's experiences of parental heavy drinking. So that was a really valuable connection that I developed through this work. We identified 4 topics among the literature: relationships and families, violence and maltreatment, health, psychological and wellbeing impacts, and social and educational outcomes for children. And in this paper, we also highlight that there are wider contextual elements besides alcohol, such as poverty, cultural norms, and patriarchal influences that intersect and exacerbate harms to children from men's drinking. So this is the policy brief that summarises the evidence from the 3 reviews and suggests some ways forward. This was produced by a range of colleagues from 10 different countries and was published at the end of September this year. So we hope that this piece can inform policymakers and professionals working in the space to be better informed about the gendered nature of this issue. We also intend that these findings inform those working with children and to better support their needs. So I'll quickly run through a few things that we suggest in this policy brief. So we suggest that decision makers should explicitly consider the evidence on these harms. Too often policy does not acknowledge the intersection between violence and alcohol consumption. So this is really first and foremost the main argument, that these harms should be acknowledged. We also suggest that more monitoring and evaluation is needed for intersectoral programs to prevent and respond to alcohol-related harms to women and children. And across all the 3 reviews, we found that these harms were often concentrated in situations of economic stress and other social disadvantage. So policies that help women and children, such as those to reduce poverty, increase women's economic empowerment, and to protect children, should also reduce alcohol-related harms. And finally, we also suggest that civil society and community-based organisations could educate communities about harms experienced by women and children from men's alcohol use through public awareness and advocacy campaigns. So this is the final part of the project, and it's a piece published in The Conversation last week, and I co-wrote this alongside Anne-Marie and our colleague from Singapore, Ingrid. So this was a really valuable experience. It's like such a different style of writing, thesis or journal article. So yeah, it was really great to do that. We've also received a bit of media from this, which means that our work is being recognised by a wider audience, which is also really great. But I think the most important thing from this article was that it further developed my connection with Ingrid, which is really valuable, especially at this stage of my candidature. And you can access the article by the QR code if you like. So yeah, tips and advice. For me, working on this project outside of my thesis was really valuable for my future career. I think if you can work with others outside of your supervisory team and even outside the university or outside of Australia, that you'll be in a great place for future projects. I think the value of cross-national collaboration is increasingly being recognised as well. So next, students really should attend as many conferences as possible and do the dreaded networking. I think it's just, really great to get to know researchers in your field on a personal level. I've also had lots of support from my primary supervisor in developing connections and taking on more responsibilities in things that are not directly related to my thesis. So my advice for supervisors is to help your PhD students in working on additional projects and making connections with other researchers. And also to encourage them to and support them in attending conferences and introduce them to people in the area. I think this advice also applies to CERI. Keep supporting the students to attend conferences and support them to take on some work outside of their thesis. Thank you. That's all from me.
Oh, well done, Cassandra. And you must be very proud of yourself. Goodness me. Conversation article just last week and media and everything. It's wonderful. So you may not have finished yet, but you're on a wonderful journey. So that's just fantastic, Cassandra. Thanks. Thanks very much for a lovely presentation. Okay, we're doing well with time here. So don't forget, we've got plenty of opportunity for discussion after we've heard from our 4 speakers. So the next person I'd like to introduce is Yvette Moika Perez. She's with the School of Psychology and Public Health and also a research officer at the Centre for Alcohol Policy Research, and was recently awarded the Nancy Millis Medal for her doctoral thesis. Congratulations, which investigated the short and long-term impacts of COVID-19 on alcohol consumption. So take it away, Yvette.
Cool, thank you. Thanks, Lisa. I'll just share my screen.
Well done on the medal. That's great.
Thank you so much.
Very recent graduate then. Good on you.
Yeah, thank you.
We can see your notes on that screen.
Oh, you can see my notes.
Yeah, yeah. Do you want to go to presenter?
Oh, that
now
works.
You're right. Now you're right. That was good. You had it right just then.
Does that work, or do you see my notes there?
Try again. Try again whatever you did
see
just
your
before.
notes.
We can see your notes
but
now.
I need my notes.
Yeah, that's okay. Just before you. Oh, yeah. Now you're right. Now that's it.
But I can't see my notes is the only thing.
Oh, okay. Well, you know, maybe we can all see your notes. It doesn't matter.
Right
I
click
don't know
on
why I didn't.
Show presenter view. Try that.
but move it to the other screen.
Like
You got 2 screens.
there we go.
Yeah.
There we go.
But then I still can't see. No, I don't know. Wait, I'll stop sharing and try again. I don't know what's going on.
We'll just, you know, we'll just play the elevator music while you just do that. That's fine. That's fine.
Because this worked before, so
yeah, look, yeah, it did work. We'll get it. We'll get there. Don't worry.
Do you see the notes there though?
Yeah, now we can see the notes again.
What's going on?
I wonder what's going on. Any advice from anyone? I'm the worst person to give advice on this subject.
Before I had to turn off presenter view and then turn it back on again, and then it worked. But I had both views on different screens.
Okay. If I try, I'm assuming that's still got notes there.
No,
though.
it's
Yes.
Can you move that screen over? Swap your screens.
swaps. Ah, so wonderful bit of advice here from M. Bulger, who says it can help to swap the screens in display settings.
Okay, let
So
me
when you're
try
in
this.
when you're in presenter view, there should be a display settings button, and it gives you the option to swap what screen has your notes and what screen has the presenter view. Sometimes I find when presenting that helps. It is tricky though.
And now you're good.
Yeah, but I don't see my notes. I mean, unless I just go without notes, but
Oh, I know. But when you've got 10 minutes, well, mhm.
but then if I show that, you still see the notes, don't you?
No, we can't see them
we
now.
don't see notes now.
Oh, okay. So I've moved to the second slide. Does that work there?
Yeah, it's all working.
Hey, all right, we got it. There we go.
We got it. There you go.
All
There
right,
you
sorry
go. A
about
little
that.
bit of
It
patience.
worked
That's
beforehand,
fine.
so I don't know what was going on there.
That's fine. We had some extra time, so it's best for you to
Yeah,
have, get
cool.
it the way you want to have it. That's fine.
All
Very
right,
good.
so
We've got
yeah, my
someone who
name is
needs a
Yvette,
meeting.
and I'm currently a research officer at CAPA, so the Centre of Alcohol Policy Research. Policy research. So before I start, I thought I'd just give a brief overview of my thesis. So my thesis, I aim to explore the impact of the COVID-19 pandemic on alcohol consumption among Australian adults during and post the pandemic restrictions. I used a variety of data sources, such as the HILDA survey, which is a household income and labour dynamics in Australia survey. A bit of a mouthful, but HILDA better for short. So that's a longitudinal survey. And I also used the AIHW, which is the Australian Institute of Health and Welfare, and they produced sales-based estimates of alcohol. So the most reliable source, which is the AIHW sales-based estimates, suggested that Australian alcohol consumption increased during the pandemic. However, I also found that there were some individual differences in consumption among key population groups, such as those who reported high psychological distress, those who worked from home, and those who reported homeschooling. So these participants reported consuming more alcohol during the pandemic compared to those who did not. So therefore, adequate policies and support services to key population groups may be needed during stressful times to reduce the increased potential for alcohol-related harms. So in June this year, I presented at the KBS conference, which is the Alcohol Epidemiology Symposium of the Kettle Brewing Society in Glasgow, Scotland. So here I've got two pictures of, so one was of the outside of the building and one is in the main area where people presented. And so I used the CERI Student Development Fund, grant to fund my flights and the conference fees. So before I talk about my presentation at the conference, I thought I'd explain a little bit about the KBS conference and how it's run, because it's a little bit different to most conferences. So presentations last 10 minutes and you present with another individual. So there's two presenters in each session. And the main difference with this conference and other conferences is that at KBS, you submit your paper 1 month before the conference. And there's a discussant, who's then allocated 2 papers to read and review. And so they identify common themes and differences between the 2 presentations, and they raise questions to open up discussion on the day. So once you present, once the 2 presenters present, the discussant then presents their themes. And after that, you get 2 to 3 minutes to respond to their comments. And then after that, the audience is then open to ask any questions. So this is very helpful as you get feedback, not only when you present on the day from people watching you present, but also from the discussant who has read your full paper. So that gives you great feedback before you submit to a journal. So a brief overview of my presentation. I examined which socio-demographic groups are at more risk of alcohol-related harms from co-workers and friends. In addition, I looked at what types of formal and informal support people use if they indicated being affected by co-workers and friends drinking. So these type of supports, so we've got informal support, which people reported if they sought support from their friends, family, or peers, or we had formal support services such as police, being admitted to hospital or an emergency department, other medical treatment, or any counselling or professional advice. So I used the Australian Alcohol's Harms to Others survey, which was conducted in 2021 during the COVID-19 lockdowns, and 2,574 participants took part in the survey. So I found that participants aged 35 to 44, those living in rural areas, and those working in managerial administration occupations were more likely to report harms from co-workers drinking. Unfortunately, we didn't find any statistical significant differences between socio-demographic groups reporting harm from friends drinking, though. Next, we looked at the experience of harms. We asked participants who experienced harm to indicate what type of support they used. So in particular, those who experienced harm from co-workers drinking, 22.4% reported they used formal supports, while 36.6% reported informal support. There's one main limitation in this study was that participants were asked about the overall support services they use. So in the survey, participants were asked about harms from their family, their partners, co-workers and friends. And so if they indicated one or any more of those relationship harms from those relationships, they were asked an overall, which services did you use? So here, these percentages, they're not exclusively only to participants who only experience co-workers harms from co-workers drinking. So they may have also experienced harm from family, and in that sense sought help from that for that reason, not necessarily from co-workers drinking. So this is a main limitation, but it also highlights a great opportunity for future research in this area, as it has not been done before. So my KBS experience, I of course presented my paper to an academic audience at an international conference. It helped develop my communication skills. I received feedback not only on my presentation, but also on my paper. It helped me network with other researchers. So I was able to discuss my paper with a colleague from the US who was interested in collaborating on a future paper where we will compare their data from the USA to our data and to see if there's any differences there, because they also collected their data during the COVID-19 pandemic. So it was it's a good opportunity to write a paper on that. I also attended other presentations, so I was learning what's currently being studied in my field and ideas for future research. And I'm currently at the moment finalizing the paper that I submitted at the conference with plans to submit that to a journal. So some advice for other students: definitely attend a conference. Doesn't have to be international. A domestic conference is also very helpful. If you haven't already, make sure that you use your student travel bursary to attend conferences. And if you have already used that and have elapsed that, you could also apply for the CERI grant, which may allow you to attend a second conference. And lastly, don't just attend the presentations. See if the conference, if you're going to a conference, see if they have any pre-conference workshops or seminars, or even lunchtime seminars, because these tend to have less participants, so it might be easier to network and touch base with people. Another thing is there may be events happening at the conferences. So for example, at KBS, every Tuesday afternoon, there's an annual soccer match. So that's a great opportunity to network with researchers in a non-work, non-conference-like environment. And lastly, some advice for CERI and La Trobe. would be definitely to continue to support students to attend conferences. So whether this is for the students to present their own work or to attend and to learn about what research is happening in their field. And also to continue to have seminars or webinars like today's, where we can hear about how students have used their funding, which will, to see how it's helped them develop their career, but also lead to good opportunities in the future. So thank you very much for listening, and I'm happy to answer any questions you may have.
Well done, Yvette, and excellent photos. I'm glad we could see them so well, that you had the presenter, the right view. So, and what a wonderful experience you had. How fantastic. So now we've got some time for questions, and I already popped one in the chat about extroverts and introverts, and I think one of the reasons why I did that was because I was on LinkedIn. By the way, you should all go on LinkedIn. I know, Facebook were boring people or whatever it is, or Insta but it is a fantastic opportunity to network and to hear about what people are doing. So I would recommend it if you're not on LinkedIn to get on. But Em, do you want to tell us about the Pac-Man rule? Where are you, Em?
Hello. Hi. It's actually something I learned about on LinkedIn. So
Me
there you
too.
go. It was probably the same post that was going around. It's very simple. It's just leaving space for at least one person to jump into your circle. So mimicking the shape of Pac-Man, if you will, which is really nice because particularly if you don't know anyone, I remember being at my first conference and just floating around looking for a physical entry into some of those conversation groups. So I thought it was a really nice thing. Yeah.
Yeah, great. Yeah, when I read it, it really resonated for me, and I think maybe the people who are that little bit more confident in those social situations and can remember to make space for the people who might have more difficulty, or younger people, or people who are at their first conference, to really try and remember what that feels like, and then make a kind of welcoming space for other people just to be able to join in the conversation or be noticed and feel welcomed. So important. Maybe relates back to Fan, your discussion about there's hard skills to learn in a PhD and there's soft skills as well. Is that partly what you meant?
Yeah. Well, I was saying that softer skills are more about social networking, presentation skills, communication. These are really important to tell people what you're doing, get attention, and get feedback, and then continue to improve. So I do find that soft skills is really, really important. Yeah.
Yeah. Yeah. Has anyone found at a conference that it wasn't just at the presentation that they got a question or they got feedback, but they got questions and feedback in those more informal kind of interactions? Can anybody give us an example or had that experience?
Yeah, I've been to a couple of conferences and presented where I got no questions in the actual conference, like the presentation itself, but during lunch or during breaks or moving between different presentations, I'd get approached then, which I guess I prefer that much better than trying to approach other people.
Yeah, Jenny, that's happened to me so often. There'll be people who didn't say a boo in my presentation, and then later, kind of once I kind of looked like a kind of person that they could talk to or something, came up and said, "Oh, I was really confused by that thing you said," or I hope you don't mind, but I want to tell you that I kind of disagreed with that, and it can sometimes be easier to have those conversations in that milling around time, can't it?
Yeah. I also find it hard when you look at the concurrent sessions that you're competing with. And there was one conference I was competing with something that was really topical at the time, and mine was halfway through my thesis, my PhD, so it wasn't even outcomes of my RCT, it was earlier on than that. And I had two people in the room. One of them was the facilitator for the session, so one person watching. So we had a great discussion around complexity of care. But yes, I myself would have rather gone to the other session because that was way more topical. And I had a chat to that presenter, and I said, look, I'm not going to get anybody come and talk to me, but I want to talk to you later. So I did go and see her
And
later.
you did.
Yeah.
Well done. That's really good. And people will appreciate that you've reached out and shown them your interest, and maybe even explain why you couldn't be at their presentation. And yeah, Admina's just had to leave, but Admina's made a really good point about that. I was talking about the introverts and the extroverts. I have to, as an extrovert, I have to constantly remind myself about what the world's like for people who are the more introverted, and that idea that your battery is going to drain. And so being very self-aware in these kind of situations can be important, can't it? And Yvette, did you join in the soccer game? Did that help liven you up?
Yeah, I did. And I think because it's so early, because I probably should have mentioned this actually, KBS runs from Monday to Friday morning. So the soccer match kind of lies in a bit on the earlier side of the week. So once you're meeting people and you're playing with them, and then during the week you see people around, so just by knowing them from the soccer match, you'd wave and you'd be able to start a conversation a lot easier just because you've met them outside of that environment as well. And I've been to KBS the year before as well, so I recognize people from like a previous conference as well. So yeah, attending those events, although it might not seem beneficial at the time, because especially it's outside of like conference times, and you'd rather maybe just go back to the hotel and rest for a bit. It does really help with the networking, because it kind of breaks the ice a little bit easier than the awkward standing there at lunch trying to get into a conversation.
Yeah. And then you can get to the stage in my career where I've got a conference that I've been going to for many, many years now, and there's the same people that are going, and we've had so many opportunities from the networking that we started there, and often now presenting symposiums together, writing together, all of those things that had really happened from conferences. It doesn't happen for everyone, but it can be, when it works, it can be wonderful. I think, Jenny, were you wanting to ask more about the conversation piece and how that got going? Because that was a fantastic thing that Cassandra presented on.
Yeah, if you've got any tips, Cassandra, I did. I'm looking at your piece, and it was in the conversation, like the place that it's been published is the conversation. How did you find that? And is there any other options for publishing conversation pieces?
I'm not sure about if there's any other options. I was also just replying to your message in the chat too. But my primary supervisor did the pitch to them, but I think it was more that I think it was a really topical kind of thing. Like they were interested. They were because I think they've not previously been interested in this area before, so there must have just been something in the news or something that made it all line up perfectly. But no, it was a completely different type of writing, and it was really hard not to be academic or writing a paper or something. And but they really worked their magic with it too. So we just my primary supervisor and I spent all day on Zoom together writing the actual, I think it was only 700 words or something that they gave.
Oh, wow.
Yeah, it's really short. And then we just mulled over every word and then sent it off to them, and they worked their magic. And
so it's literally written as a conversation, that you're having a conversation about whatever the topic is. That's what it looks like. Yeah,
they give you prompts, and I have little subheadings and stuff. So they structure it and they tell you what they want once they know about the topic and about the research. So it's good. It's definitely a
Very
good
good.
experience.
Claire, I'm going to be on to you next week. I think we need to do something in that space.
Well, it is that process, isn't it, of doing a pitch, and then if you get past that point, but then it's writing that's not that easy. Did you find that, Cassandra? Like that
Oh, it
whole
was
day?
so hard. Yeah, honestly, we agonized over like every word. We're like, is this what they want to hear? Yeah,
Because you don't have that opportunity to clarify that you have in a longer paper, so you really need to make sure that
everything counts. Yeah,
every word counts, and you want to make sure that you're sending the message
yeah,
appropriately.
I guess the headline and the photo that you use would be really important, and a bit like a YouTube, like the banners they use on YouTube. Like that's really important to the article. So,
Yeah,
definitely. I mean, they gave us the headline before we'd even written it, and
oh
then
wow,
they chose the photo.
oh,
wow.
interesting.
So they know what they're doing.
Yeah, I'm on the
I've got
ARC
lots of
College of
ideas for
Experts.
that now. Sorry,
Oh,
Lisa.
sorry, Jen. No, I'm interrupting it. I'm on the ARC College of Experts, and I can tell you that people are very impressed when they see that people have got conversation pieces. So it is very highly regarded as an impact and knowledge dissemination activity. So great. Now, has anybody done the red team's look, M has got thanks, M. And I'm sorry that the person F. Howick, is that Fiona or is that, I'm guessing their first name. The red team does a great session on going to the media with your research. Have you done that? Has anybody done that one? The red team's session and going to the media? So that's where you have to get over your imposter syndrome. And I mean, I'm not sure whether that's what they teach you in the session, but I imagine that there is that kind of thing about feeling confident enough to go to the media and feel that you really need to get what you found out there and try to influence policy. But Em, tell us about the what have you put there in the chat?
I'm a research librarian, by the way, and I run the graduate research scholar newsletter. So this was sent to me by some of my colleagues in the red team, and it was just a recent item, and it looks like it's on next Wednesday, and you can still email Rob and Grace at that email there. And I've heard really good things from people who've attended. They run it, from what I can tell, about 3 times a year or 3 or 4 times a year.
That's great. Thanks, Em.
No
Fan.
worries.
So Fan, you were mentioning the red team. Did you do that session? Have you done that session? Can you take yourself off mute? Do you feel comfortable?
Yeah, I'm currently in the library and breastfeeding, so
Oh,
video is
sorry.
off. But yes, I did go there, and quite early on in my PhD journey. Felt very inspired. Highly recommend.
Oh, that's good. Thank you. Sorry, I didn't mean to interrupt you. That's fantastic. And there was a question here about the grant being available for posters, and Claire, you responded to that. Yeah, look, I would say that a poster. The first conference I went to, I got a poster. There was loads of interest in my poster, and then there was a journal that was attached to the particular conference, and the editor of the journal invited me to write up my poster as a paper. Who knew? So don't underestimate the value of a poster. Does anyone want to share what you might do next now that you've gone off and had the experience that you had because of the CERI funding? And maybe with any particular link back to what you actually got out of the funding. It's a hard question, but like, are there any new research questions or areas for deeper investigation Some of you have already talked about that, but here's your chance to say more.
I can have a go, but it's an idea that's not yet, yeah, we've not started working on it yet, but I mentioned CERI from Norway, and she got access to this amazing data set. It's like kids helplines, and we're going to qualitatively examine that, but it's such a large data set that she's working with her, I think, like an IT person to use AI to make it smaller basically and pick out the kind of important bits, because they've got like just so much data. So once that's been done, that's a project that we're going to work on together, but I think that's might be a while away now. But that came about because of working with her on that paper, which was supported by CERI. So
that's fantastic. And it's interesting that you mentioned AI and its role in research in the future. Is that an area where people are starting to think more about what role AI might have in their future research efforts?
I'm doing some research using machine learning in predicting diseases, and also look at deep learning currently. I think we are talking about different things, maybe. One is large language model. Well, we have colleagues, do a study, see whether the chat box can help patients or help the GPs in helping the patients in less developed country. But they do find some AI have some biases. This is one kind of AI. Another kind of AI is more about, compared to traditional statistical learning, machine learning can pick up the data patterns that cannot easily be picked up by traditional statistic methods. I think currently I'm more focusing on the machine learning instead of large language model. Because there are still some issues like hallucination, because they can fabricate things. And it's sometimes if you use large language model to do something, every time they produce different things. But research is about how you're going to be able to replicate what you're doing.
Good points. Thank you, Ben. In fact, I hope you don't mind, but I did have a question about just your research, actually, because you mentioned the comparison between China and Australia in terms of outcomes with stroke. And I was actually, and I can't help but ask you, are there's the same pressures on inpatient beds? You talked about the pressure for people to be discharged and potentially discharged too soon. Does China have the same problems, or do people have longer inpatient stays there, or is the problem more getting access to inpatient beds? Do you know?
So the system works very differently between China and Australia. In Australia, majority of the inpatient rehabilitation in public hospital is funded by the government. If it's funded by the government will look at how to use the money efficiently. So they encourage patients who have quicker recovery as measured by the functional performance points. And it's reflected by the payment mechanism in Australia, because they measured the length of stay. If they stay longer, the daily weight for the payment is getting smaller. So so that's how Australian works. In China, the problem is they have lesser coverage of public funding for rehabilitation. so patients have to pay out-of-pocket money. So that's causing lots of problem because some less developed regions, they have lesser patients get rehabilitation. And so the problem is more about provide universal coverage. So in Australia, I think it's more about how to reflect in patients' outcomes, not only focus on how to use the money efficiently, but also look at how patients can maximize their potential gains. So I was saying potential gains, people have different potentials. Some patients admit with higher functional status, they have lesser room to improve. Some patients admit with lower functional performance, they have larger room to improve. So the relative functional gain is we look at how the rehabilitation can help them to regain their functions relative to their best potential, maximum potential. So in Australia, for those who need longer time to reach their best potential, the funding does not incentivize that because it's only incentivize those with shorter stay. So overall speaking, the two systems are very different. They are at different development stage, but they all have their unique challenges.
Oh, Ben, you're going to make a fantastic contribution, I think, to this area. So important, isn't it? So important to maximize people's opportunity for recovery. Any other questions from other people? I could just keep going forever, but you may not want to spend all of your Friday afternoon here. But any other questions from? Have I missed any in the chat? I hope you don't mind. I'm going to go back to Jenny just for a minute because I did have one. Oh, there's Van. We can see her beautiful baby. How lovely in the library. It's gorgeous. So Jenny, would you mind I'm interested because you were talking about implementation. Did the course introduce you to any actual implementation science models like the Consolidated Framework for Research Implementation or the Paris Framework or any of those? And do you think you might use those in the future, or what's your thinking about that?
Yeah, they focused on the CFIR. They did talk about the Paris model, but their focus was on the CFIR. But they gave us so many resources around other models that are out there. The model I used was Claudia Mayer's adaptation for aged care of an implementation model. So they had her tool, like they had so many resources. There's so many different ways of doing the implementation, but the core of them all is all the same. That how you set up your project right from the get-go was highlighted as important for all of the models. Yeah. But the resources
so it does
that
sound
you
like
get,
a fantastic course.
Yeah, it was. I think it was $700 or something. It was well worth it. And yeah, the resources, and you get access to the platform for another 6 months afterwards, after you finish, and you've got a year to finish the course. So in theory, it takes about 3 months to do it, and then you've got access for a while afterwards. And there's other levels, and they're building other qualifications over time. So there's a next level of qualification that they're in development of now, and then the third one's being developed too. So they're a bit dearer. And the third one, I think, is a certified qualification.
Sounds great. Okay, so
this is Fan here.
Sorry, Fan.
I just wanted to. What was do you mind putting it in the chat? I missed that part of your presentation of where you did this course from.
I had them open before. I will put the link in.
Yeah. So the link to the course.
There's actually not much formal training in implementation other than doing it. This was the only one I could find that actually gave me an opportunity to play around with different things rather than being tied to one project.
Yeah, thank you.
That's good. Okay, well, any other questions? And it's okay for that question to be about if anybody's applying or wondering whether they're going to apply, because you can ask for the practical questions as well.
Can I ask, is there industry partners to, with CERI that can offer any joint projects or any initiatives CERI is working with industry? Yeah.
Good question. I'm going to hand it over to Claire.
Yeah, that is a great question, Fan, and also you mentioned that in your presentation as well. So we have something called the Care Economy Collaborative Network. It's an initiative by the Research Institute that sort of encourages industry partners from across the health and social care sectors to join our network. It's like a big community of practice. So dependent on the area of research you're working in, it can work one of two ways. Often the industry partners will come to us and say, we have this problem, this challenge. Do you have a researcher who specialises in health economics? We get asked that a lot, actually. So I took point of that. Or, do you have a researcher who specialises in aged care or, family violence? And then we make the connections that way. Alternatively, it also can work if you have a particular area you're interested in and you might be looking for an industry partner. We can put you in contact with those people too as well, or put you in contact with another professor like Lisa, who is immensely well connected across the sector, and you can have that conversation and go from there. So yes, come to us with your questions.
Thank you. Yeah, I think it's great to know that we have great partnership with industry. If we can see somewhere on our website what they are looking for, what projects we may take on, I think this opens more opportunities for future HDR students.
It is actually on our website. The Care Economy Collaborative Network is on our website with a list of all the organisations that have joined. So I will find that and drop that in the link before we finish, okay?
Thank you.
Okay, any more questions? Well, look, I just want to thank everybody for participating. We can all give I think we can give if you can do a little reaction, do a bit of a clap for our 4 wonderful presenters, and also for Claire, who's really given us some fantastic tips on both applying for these support grants and also how you might connect up with CERI about partners. And how about that? There's a couple of other things that people can follow up about: the conversation, about approaching the media, using the resources within the university to support you further in your work. But I just want to congratulate all of you for the work that you've done, and it just makes me so excited for our future to have people doing this work, and to see some people turning now from being PhD students to early career researchers. Congratulations to them in particular. Good on you, and we'll see you next time.
Thanks, everyone. Thanks, Claire, for organising.
Thanks, Claire. Well done, everyone.